This case study is on arterial ulcers. So I don't have access to the vascular lab at my clinical site yet. That probably won't be until the fall, but I did research some common signs and symptoms of patients that do have arterial ulcers when they do come in, and that consists of immense pain and tenderness, swelling of the affected leg, toe, foot, or ankle area. That's the most common location of where these ulcers occur at. And then discoloration of the affected site. So the ulcer typically has a white, opaque, or creamish color border before it gets even more infected. And depending on how infected the ulcer area is, it could have gangrene resulting in like a black infected area, as well as the whole leg, foot, toe, or ankle area will be like hyperpigmented, so red, and I could even have some little blood flow nutrients. It could become purple at some spots. Each case is different, just depending on how far and severe the ulcer is for said patient. Some pertinent information: the pathology. Arterial leg ulcers are caused by continuous venous hypertension, which is, quote, a result from chronic venous insufficiency. That's quoted from an article I found called Venous Leg and Arterial Ulcers by Greg, Harding, and Enoch. So the hypertension in the veins is most commonly caused by incompetent valves. So the veins just aren't getting the oxygen and nutrients they need due to poor blood flow, or the valves in the said vessels just not working properly. Incidence is that men over 45 and women over 55 have a higher chance of developing arterial ulcers. Etiology: varicose veins, deep vein thrombosis, family history, chronic venous insufficiency, and poor calf muscle function, obesity, and atherosclerosis. Those all play a role in venous arterial ulcers. Atherosclerosis is the most common cause of arterial leg ulcers. The course of the disease is around the foot, ankle, or toe area. Blood flow becomes decreased. This results in a lack of oxygen and nutrients. That area of the skin then becomes weak, resulting in an opening that can lead to further infection. Further infection can consist of such as gangrene, pus, anything that's really should not be available to open skin area. Treatment includes surgery or pharmaceutical, whichever method improves the blood flow of the veins to prevent more ulcers from happening. You want to improve the blood flow because poor blood flow is the reason why these ulcers happen in the first place, because the area wasn't getting enough oxygen and nutrients. An angioplasty may be used, as well as a bypass operation, which will reroute the blood flow in hope of preventing future cases. Another important factor of treatment is how said ulcers are wrapped and bandaged up. They need to stay sterile and clean in order to prevent said gangrene from happening or further infection. Prognosis: with quick diagnosis and treatment, the ulcer could begin to heal. However, if not taken care of properly, arterial ulcers can lead to infection, gangrene, and possible amputation. Also, like mentioned before, it's important to keep the wound area and bandages clean and wrapped properly. The differential diagnosis of an arterial ulcer: it's just important to know whether you're scanning and diagnosing an arterial ulcer or a venous ulcer. for the main reason that compression therapy is what's often used for venous leg ulcers, which could lead to skin necrosis and possible amputation on arterial ulcers. Arterial ulcers are small, round, and have well-defined borders and shape in what differentiates ischemic ulcers from vascular ulcers, which are typically irregular shaped and do not have defined borders. So, as a discussion, arterial ulcers occur due to a lack of blood flow, which results in a lack of oxygen and nutrients to said site, in an open wound, and further complications and pain. Appropriate surgeries and medications are the main treatment for arterial ulcers. It is important to know whether you are examining an arterial or a venous ulcers because they require different types of treatment. So I found this image. The one on the left is a diagram of like a very basic arterial ulcer definition. It has a well-defined white border. It's around the ankle area. On the right is the ultrasound. It shows how, there's the lack of blood flow in that one area due to narrowing of the artery, and due to that lack of blood flow or smaller amount of blood flow, there will be a lack of oxygen and nutrients to that area, resulting in weakening of the skin and an ulcer. This was another picture I found, just showing chronic arthroma in the SFA. Another one showing less blood flow. There's a lot of turbulence where you're out. This was an image of a bypass, so that was one of the treatments that could be performed. How the one on the left, it's a long bypass, it just completely goes around the artery. The one in the middle is a short one, and then the one on the farther side shows a combined bypass as well as another medical treatment. And then this is where I'm excited.